So it's so simple, but complicated because it's like, well, I know all the steps in collagen formation, but then you also kind of understand that this test is tricky, but you have to play the game. It's like, well, if I see these two, it could either be X and Y. So these get knocked out right away. And by default, the sequence is always glycine XY. I know you've seen this probably a couple of dozen times, if not more. It's the first line of the actual step process. But because there's so much information we have to be responsible for, it gets tricky, right? Of course it does. So you say to yourself, crap, I kind of knew, but I forgot. It's okay. No problem, right? It's all here. Keep glycine always in play because glycine, no matter what you do, it could be proline and lysine or hydroxy. It's always going to be glycine. It says collagen is a third glycine. Glycine content of collagen is less variable than that of lysine and proline. So moving forward, please don't write this out and memorize. Say, okay, there's 4 steps inside, 1, 2, 3, and 4. There's 3 steps outside. Clearly, ladies and gentlemen, doctors from all over the world, look at this. And the first 3 steps are actually in RER. Wow. So I don't know about you, but when I read stuff, I don't read it like I did as a student, even as a physician. I read it more as a test taker. I'm like, well, this is so much information. What do I need to know to remember? Well, the first 3 steps are actually part of this stupid thing, RER right here, right? 1, 2, and 3. The 4th one's by itself, and the last 3 are outside. So they could ask me questions on the first 3 steps of collagen formation, and I remember the first 3 are part of the RER. You see how horrible this is when you know every possible step, and then they ask you which one's in the RER, you're like, crap, I forgot. Because it's something so simple as this, we overlook sometimes when we are overwhelmed with so much information. And I'm here to guide you. I'm here to kind of say, put the brakes on, punch the gas, slow down, accelerate. This is why I do what I do best, because I want you guys to pass the test, right? I don't want you guys to kind of just do monotonous things and study and read and watch videos. That's not going to help you, right? If you're not getting to a 62, 65 after 2, 3 months, there's a reason why. There's some miscommunication, misconnection there. And I'm here to help you find the misconnection and actually get you to get points, right? Yes. So go through it. Kind of cool. I mean, look at the other answer choices. Proline at 19, 11%, 14%. They got stuck. It's okay. You won't get stuck, but they will. Other people will, right? Take your time with it, guys. Take your time with it. I promise you it's going to be very, very beneficial. I don't know about you. Vitamins are big. Vitamins. Vitamins are so easy to learn overnight. This is where you get your points. Now, I'm going to show you something which actually piggybacks the previous question. I'm going to do a vitamin question on top of that, right? I need your help. Let's see here. Was it a little USMLE nitpick trickster? My mind definitely went to proline lysine. Yeah, I got you, Jordan, man. I get you. Yeah, it's definitely tricky, but I'd rather make mistakes. Exactly. One of my mistakes now, learn how to overcome these mistakes now. I'd rather you trip and fall now with me. So later you say, I know these tricks. I know that I kind of want to choose the answer, but Dr. Stavros says, no, take a deep breath and double check, right? That's why we practice. Practice does make perfect, but you also have to have perfect practice or else you're not going to do well, right? Good. Let's try this question. This is a piggyback off the previous one, meaning it's the whole formation. I want you guys to be able to diagnose this for me. First step is first. I'll carry the workload. I'm here to help you guys, right? But I need some help from your end. I need you guys to participate. I need you guys to give me some of the differentials to let me know what you think this is. Okay? Awesome. So I'm going to read this and we're going to go from there. We have now physical exam shows velvety, fragile skin that can be stretched further than normal and multiple chemoses. Okay. We have joint range is increased. Joint range of motion is increased. So we have stretched skin, multiple chemoses. We have now also joint range of motion is increased. A defect in which of the following is the most likely cause of the patient's condition? Go to the top. Some of us already have the answer. Some might not have the answer, but it's okay. So if you read the last 3 lines, typically 80% of the time you'll have enough power, enough info to get the answer. If you don't be upset. It's not mandatory. You go to the top and read. Something has to give the answer away, right? So we go to the top if necessary. A 5-year-old boy comes to the doctor with his parents for evaluation of easy bruising. Okay, he's met all his developmental milestones, which means that there's no deficiencies, meaning like his head, circumference, and his weight and height pretty good. Vitals are good, 50% height and weight. Okay, some doctors are saying, yo, EDS, awesome. Here's a problem. What's the answer? They're like, I know it's EDS. All right, cool. What is the answer, doctor? Because this is what beautiful USMLE does. They take whatever you know and they make it and they flip it upside down. They go, you know EDS? Congrats. What's the answer when they give you the stupid list here? We have here alpha collagen triple helix. We have alpha 1 antitrypsin production, fibrillin 1 glycoprotein production, proline lysine hydroxylation. Isn't hydroxylation vitamin C? Hydroxylation, C, vitamin C, scurvy. Well, that looks familiar to me. That's out because the more you study and the more you review every answer choice, I promise you, you will have so much information oozing out of you like, this is easy now. Because I don't even know the answer, but I could knock out the answer choices. That's where you got to get to. To survive this exam, you have to have power to eliminate. Years ago, different story. Now, this is only going to survive. So we take out proline lysine hydroxylation, vitamin C, scurvy. Okay. What's fibrillin 1? What's this one here, guys? What's C? It's not the right answer, but what's C? Marfanas. Yes, Marfan. Out. Beautiful. What's alpha 1 antitrypsin? Alpha 1 antitrypsin. You guys all know this answer. Alpha 1 antitrypsin, what do you usually see alpha 1 antitrypsin? You see a person who has liver dysfunction. It could be issues with lung problems. They're not a smoker. So that's a lot of issues, right? Yeah, yeah. Panas and emphysema. This person doesn't have that, right? No.